The procedure that I'm setting up for right now is for an X-lap, an exploratory laparotomy. Basically, we're going into the abdomen to see what's going on. The patient was having pain, so we go inside to run the bowel and look at all the other organs. As a surgical tech, we are in charge of so much, including organizing, maintaining the back table, and sterility during the case. We gown and glove anyone who comes into the case, so our surgeon, our med students, our residents. We make sure that we have all of their gowns and gloves also. We count for the case, so we count all of our sharps and instruments for this case. And we also have to make sure that we have everything the surgeon needs and or may need. So usually in the room, I keep a box of items that the surgeon might need, and those are just on hold. Once I'm to the point where I can count, I start counting with the nurse. Soft things always comes first, and then we go to sharps. So I'm counting my sutures here. I count my hypos, my blades, my bovie tip, anything that's sharp. These towels are also countable because they're radiopaque, which means you can see them in the body. And sometimes a surgeon will put a warm wet towel or a lap inside the body. So we count them before they go in and after they come out. Also, here I am loading a blade with a needle driver and my fingers. Personally, I think loading with my fingers is easier because there's a groove on the knife that the blade has to fit into and you can feel it better. I'm only stapling the silk tie to the towel and not to the Mayo stand, otherwise that would be contaminated. On cases like these, I always double line my Mayo because I have a little pocket that I can put stuff in without having strings everywhere. Last step is to get my towels and everything ready for draping. I did add Raytex, so anytime you add anything that's countable on your field, you count it out loud to the nurse. And these are for my sponge stick. There's 2 ways to do a sponge stick. I've had surgeons request both. Most of the time they like this one. I call this the wonton. The other one just shows the metal on the sponge stick. There's no right or wrong way, but surgeons will prefer one or the other. The first one's just tighter. Here's my complete exploratory laparotomy setup. If you have any questions, let me know and I can make a video on it. Thanks, bye!